Who is at high risk for tuberculosis? Have you ever wondered who might be at a higher risk for tuberculosis? Understanding this can help us take steps to protect ourselves and others. Certain groups of people are more likely to get infected with tuberculosis, also known as TB, or develop active TB disease. This is often due to factors that increase their exposure to TB bacteria or weaken their immune systems. First, let's talk about those who may be more exposed to TB. People who live or work closely with someone who has active TB, like family members or coworkers, are at higher risk. Additionally, individuals in congregate settings, such as long-term care facilities, correctional facilities, shelters, and healthcare environments, face greater exposure to TB. Immigrants and refugees from countries where TB is common also fall into this higher risk category. Healthcare workers and humanitarian aid workers in areas with high TB prevalence, like refugee camps or clinics that treat HIV patients, are also at increased risk. Children who are in close contact with someone who has active TB are particularly vulnerable as well. Now, let's look at those who might progress from a latent TB infection to active TB disease. People living with HIV or other conditions that weaken the immune system, such as malnutrition or diabetes, are at a much higher risk. Children under 5 years old, especially those who have recently been infected, are also at risk. Individuals who have recently been infected with the bacteria that cause TB are more likely to develop the disease. Additionally, patients with certain medical conditions, like end-stage renal disease or silicosis, and those awaiting organ or bone marrow transplants, are at increased risk. Socioeconomic factors also play a role. People experiencing poverty, homelessness, migration, or incarceration often have limited access to health care, which can increase their risk of developing active TB disease. It's important to remember that TB bacteria spread through the air when someone with active lung TB coughs or sneezes. Just a few bacteria can lead to infection. About 1/4 of the world's population is estimated to have latent TB infection, but only 5 to 10% of those will go on to develop active TB disease in their lifetime. For those who are immunocompromised, the risk of developing active TB is significantly higher because their immune systems cannot effectively contain the bacteria. Screening and risk assessment are crucial tools to identify individuals at high risk who may benefit from testing and preventive treatment. By understanding these risk factors, we can better target prevention, screening, and treatment efforts to reduce the transmission of TB and its burden on communities. Always consult a healthcare professional for personalized advice and information.